Imagine knowing someone who is suffering from a terminal illness. They know their disease is going to kill them, but they don't know when. It could be 5 years, or it could be 5 days. They want to turn to physician-assisted suicide to end their life. Is this morally acceptable? Society says it is not, but I think it should be. In a 2017 article from the National Institute of Mental Health stated suicide is ranked 10th in cause of death in the United States. Some people who are unable to die by physician-assisted suicide turn to suicide to end their life. Physician-assisted suicide is not morally acceptable, but it should be. People with life-threatening diseases should not have to suffer. If someone with a terminal illness is suffering, then they should have the right to end their own life. A study was performed on the motivation for physician-assisted suicide, and one of the patients in the study was Anna, who was diagnosed with metastatic ovarian cancer at the age of 62. She wanted the right to control and decide when she could die. She said, "One of my landmarks, if I'm at the point where all I can do is lie in bed all day long, then to me that's probably not living anymore." She had chemotherapy, radiation, and multiple surgeries over the course of 4 years. Nothing was helping, and she kept getting sicker. Anna decided to go through the process of getting the appropriate medication for physician-assisted suicide. However, she did get her family's permission prior. She talked about how having the medication gave her more energy to fight her cancer, knowing that suffering was something she didn't have to worry about. One of her side effects from radiation was an obstructed bowel. It eventually resulted in Anna having repeated transfusions to keep her alive. She knew that she did not want to suffer in a hospital and wanted to die peacefully at home. 3 years after receiving the medication, she gathered her loved ones and took the medication. She passed away within 2 hours. Physician-assisted suicide is still relatively new. There are not many states that have legalized this. Is there a solution to this problem? In 1998, Oregon passed a law permitting physician-assisted suicide. As stated in the Death with Dignity Act, these deaths are not considered suicides. In order to receive a prescription for the medication, there are certain criteria that has to be met. The person has to be at least 18 years of age, and they must be an Oregon resident. They must have a terminal illness with 6 months or less to live, and 2 physicians must confirm the diagnosis and prognosis. They must be offered hospice, and they must make 2 oral requests within 15 days apart, and 1 written request with a witness present. This strict criteria is put in place to prevent anyone from being able to obtain the prescription. As of 2017, based on the article, Oregon's Death with Dignity Act, 20 years of experience to inform the debate, 5 states or jurisdictions also have similar laws: California, Colorado, the District of Columbia, Vermont, and Washington. 1,179 Oregon residents died out of 1,857 from taking the medication from 1998 to 2017. Most of the people who did not die from the medication died of their disease. From the time the Act was implemented in 1998 to 2013, the amount of Death with Dignity Act deaths increased annually by 14%, and then from 2013 to 2015, the number increased to 36% annually. It eventually leveled off in 2016. It was found that most people who died this way had cancer or ALS. The Death with Dignity Act is put in place to control physician-assisted suicide. Now that we have found a solution to the problem, how can it impact people positively? There are 2 major positive aspects to physician-assisted suicide. Everyone has the right to autonomy. This gives everyone the right to do whatever they want with their own body. No one should be forced to be miserable and suffer. For example, if we see an animal suffering, then we can choose to euthanize it. We do this knowing that it is more beneficial for the animal. If we have the choice to do this to animals, then why do we not have the choice to do this to ourselves? Another aspect is physicians are supposed to help patients not suffer. A 2001 article, The Positive Virtues of Physician-Assisted Suicide. Physician-assisted suicide is among the most notably debated bioethical issues of our time, states that if a physician has exhausted all responsible palliative measures, it is the patient and only the patient who can judge whether the death is harmful or a good to be sought. Physicians should have the right to be able to offer prescription to help someone in their life who is suffering. What can be done to help this become legal? Passing a physician-assisted suicide law could lead to end suffering for individuals with terminal illness. As of June 2019, Maine was the 8th state to legalize assisted suicide. As more states begin to make this legal, others might follow suit. There are other people in the U.S., similar to Anna, who wish to die by physician-assisted suicide. Oregon became the first state to legalize physician-assisted suicide, and since then, others are slowly starting to pass the same laws. You can write to your congressman and tell them to consider making this legal. Having physician-assisted suicide as an option for terminally ill patients can lead to them knowing that they can live their lives to the fullest.